Okay, so let's revisit the idea of masks. I know, I don't like wearing masks either. Nobody likes to hear about masks. We're tired of hearing about masks. But it's important that we talk about the most recent updates from the CDC regarding what the best masks are to wear, especially in light of the Omicron variant. Now, the thing is science is a messy thing. So I know it seems like we one day said this, the next day we said don't wear masks, the next day we said this. That's what science is about. We learn things as we go, we gain more data, and we make changes so that we can make the appropriate recommendations. What I have on my face right now is a surgical mask. Sometimes it's also called a procedure mask, a medical grade mask. The difference between this and some other masks is that there's actually an electrical charge that's built into the weave of the material that actually helps repel the actual molecules and the viruses themselves. So that's why this is actually the preferred mask to wear in general out in public. We wear these when we're not in a patient's COVID room in the hospital. Now, this mask is what's called a KN95. This one is typically used in industrial settings for really fine dust particles, things like that. Works really well for things like coronavirus. It's not so much that it's better than the surgical mask, it's just a little different. This might be something that you would wear if you go on an airplane and wanted that extra little bit of protection. So this is what you would be able to find at a local hardware store, a grocery store, and online. But beware of the online ones. There are counterfeit ones. Make sure that there's actual markings on the masks themselves. Now this mask obviously is a cloth mask. My wife actually made this mask. So the CDC, a while back, started saying things like, well, the cloth masks were worthless, they didn't do any good, that sort of thing. They've since tempered that a bit to kind of more appropriately point out that single-layer cloth masks are probably the ones that aren't very effective. So things like a gaiter or just a bandana, things like that. Those have never really been, at least in my mind, that effective, but the CDC had come out and said that's what we don't want. This mask actually has a couple of layers. There's obviously the outside layer that you can see, there's an inside layer, and my wife actually made this with quilting material, so it's actually very thick weave. So I can tell you this mask is a lot warmer than a surgical mask is, and it will actually provide decent protection. This is certainly an option for you if this is all you have. The big thing is you want to make sure that there's more than one layer of material here that light won't shine through it. Okay, so the final type of mask we're going to talk about is an N95, the kinds of masks that we in healthcare use when we actually go into a patient's room with COVID or some other airborne droplet infectious disease. Now I'm going to take this off so that you can actually see how I put this on. This is one type of N95. There's another type that's called a duckbill type, but this is what we have. And it definitely takes a little bit more to get on. Now this actually I've been fit tested for. So this is actually a seal along here, so I cannot get air in or out. And as you can imagine, this is not the most comfortable thing in the world. My travel from my nose to my chin is more difficult to talk. So I'm able to talk, but it's not quite as comfortable. This is sort of the ultimate when it comes to protection relative to a mask that you put on like this. Okay, so now I'm going to get to my favorite part about wearing this mask, which is taking it off. This is not my favorite mask to wear at all. So I hope this has been helpful for you as far as trying to decipher what the CDC has now come out with. So let's just recap for a second. Surgical mask, procedure mask, probably the single best thing you could probably wear. You have the option for the KN95, little thicker support. You can certainly wear a cloth mask if, as we said, it's got more than one layer and you can't shine light through it. You can't see light as you shine through it. But in general, this is what you want to wear. This is going to help the best that we can do right now against the Omicron variant. So I hope this has been helpful. Stay well, stay safe, and we'll talk again soon.